Welcome to ReGenMed101 podcast with Dr. Yu. Learn about all things medicine, health, and wellness. We hope you enjoy listening. Please show your support by subscribing and follow our podcast.
Welcome to ReGenMed101 podcast. This is the interview series. I have here a special guest today, Dr. Jamal Khan. Welcome, Dr. Jamal Khan.
Thank you, Dr. Yu, for that welcome and for having me on the podcast. It's a pleasure being on. I've been listening to your podcast for a few months now, and it's great to see the things that you're doing now.
Well, thank you very much. With this interview series, we always have this structured format. What I'd like to ask is if you could tell the audience your medical background, mainly your internship and residency.
Sure. Well, I'm a native New Yorker, born and raised. I did my medical training at the NYT College of Osteopathic Medicine, which is in Long Island, New York. I then did my intern year at Northwell Plainview Hospital, which is also on Long Island, New York. And then after that, I did my residency at Stony Brook University Hospital, where coincidentally, I had actually done my undergrad training as well.
Yeah, that's great. Just for the audience to know, Dr. Jamal Khan here is also a chief resident graduate of the physical medicine rehab department for Stony Brook. That must have been pretty tough work for you, I assume.
It was tough at times, but I would say that for the most part, I would say it's more rewarding than anything. Just having the opportunity to work with the junior residents during interview season, getting to interview a lot of the candidates, getting to work closely with some of the faculty. So it definitely was some added work to fourth year, which was already busy, when looking for fellowships and trying to decide what's coming next. I would say it was more rewarding than anything.
No, that's absolutely great. Obviously we've worked together quite a few times. We went to a few conferences. I know that you are currently in a fellowship. If you could maybe tell the audience what you're doing for fellowship and where you're going to be at, and maybe just a little bit more about the program itself. What will you be training in? What kind of procedures, things like that?
Sure. Well, I'll be doing my pain fellowship at the University of Minnesota. So the University of Minnesota, it's a PM&R based pain fellowship. They have some anesthesia in the department as well. It's nice because it's one of those multidisciplinary pain fellowships. We have an anesthesia resident that's going to be there also. They do a lot of different procedures, from epidural steroid injections to ultrasound-guided injections. They use a lot of different modalities in that sense. I remember when I was looking at fellowships, one thing I really appreciated about the University of Minnesota is that they have an exposure to a variety of clinical settings during the fellowship year. It's going to help me make my decision in terms of future practice. So that's something that was really important to me as well.
So, Dr. Jamal Khan, you have also helped participate in our hip fracture episode. So, for one, I definitely want to thank you for that. Overall, though, what do you think of ReGenMed 101? Do you like the concept? Do you believe that there is value added by having us do a podcast for the general public?
Of course I do, and thanks for having me on the podcast before for doing the hip fractures and for this as well. And like I said before, ReGenMed 101 is something I've been following for quite some time now, pretty much since you started here, and I think the concept is great. Just having this as an available resource for anyone really, physicians, the general public, patients, just as something you can turn to for a nice overview of topics, and that's great. For the general public, I think the topics are nicely summarized in a way that's clear, informative, and I'm looking forward to listening to whatever comes up next. I'll definitely be an avid listener and an avid fan.
Absolutely, and thank you again, and we hope to participate more in our future podcasts as well. So, Dr. Jamal Khan, what are your hobbies? What keeps you stress-free? What keeps you busy, and what do you like to do for fun?
Well, I used to be a very avid basketball player up until maybe med school or so. At the time, I was playing 5 to 6 times a week or so. I quickly realized that that's not so great for my knees. So I still play from time to time, but not what I used to do. Nowadays, I do love biking, and being in Minnesota, that's something that's great for that. I remember when I interviewed here for fellowship, after my interview, I actually went nearby looking for trails because that's something that's important for me, and just to keep my mind at ease, and it did not disappoint. And the whole being outdoors and outdoor vibe is something I love. So even if it's not biking, it's hiking, or it's something like camping, and they just keep me leveled.
Yeah, that's great. And, just for the audience to know, I've met Dr. Jamal Khan a few times, and, he towers over everybody. I would assume that you play more center. It's great that you are very outgoing, that you love nature as well. I'm sure Minnesota offers quite a lot of that as well.
Yeah, and I'm looking forward to being here and just, experiencing the whole Minnesota vibe. They say there's no place like home, and for me, home is New York, but a whole world out there to see, so Minnesota is what's next on my list.
That's great. Thank you very much, Dr. Jamal Khan. Because we're both in the same boat, because both of us are in the same training, currently we have to study for the Physical Medicine and Rehabilitation boards. For the listeners out there that are also residents, training in PM&R or even thinking about training and applying to PM&R residency, is there some kind of resource that you use that you would advise other upcoming trainees or even current trainees when studying for the PM&R boards?
Yeah, that's a great question, and there's so many different resources out there, and if you do a quick Google search or ask people, you're going to get a whole bunch of different answers. So that's what I did, and I got a whole bunch of different answers, just talking to different people and summarizing in terms of the best resources available. I think in terms of actual content-wise, I think everyone uses Gorilla Review Book, which is great. It has a bunch of information. It's a quick read in general compared to other textbooks. For me, I also like doing questions, and I think that doing questions after you review the topics is something that's important. So I do use the AAPM&R question bank, but I also use an app from Dr. Lynn Weiss. It's called Demos Medical, and it has a bunch of board review questions on there. So it's great for when you're on the go, when you're on break, you need some time to just brush up on a few questions. You can just pull it up there, and you can do it, and it's great.
That's great. Just so you know, we are not affiliated with the review book by Dr. Sarah Cucurilla, which is the PM&R board review book, and we're not affiliated with Dr. Lynn Weiss's PM&R Q&A bank. However, I have to say, Dr. Lynn Weiss recently joined my alma mater at NYU, and I have to say, just her few lectures on EMGs has been phenomenal. She is an incredible addition to NYU's program, and I understand that she was also previously at yours as well, and I can tell quality residents who trained under her.
Yeah, and I remember when I was in med school, I did a rotation with her, and I've seen a bunch of lectures that she's given, and, she's great. She's one of those originators in the field, it feels like, and, I think a whole bunch of us have learned a lot from her.
So, Dr. Jamal Khan, before we complete this podcast, is there one thing that makes you unique that you'd like to share with the audience? Are there any hidden talents, or is there something that is just absolutely special to you that you would like to share?
Well, I'm not sure about unique, but being a big sports fan and a traveler, something that my fiance and I have on our bucket list is visiting every baseball stadium across the United States. So far, we've hit most on the East Coast and some in California. Now that we're in Minnesota, it's going to be time to check out some of these Midwest stadiums. And in line with that traveling, I do love cruising also, and I try to go on annual cruises with my family. But it's been a few years since residency, since it's been so busy, but I'm looking forward to restarting that up again soon.
Oh, great. Well, Dr. Jamal Khan, thank you very much for your time. I really appreciate it.
No problem, Dr. Yu. I'd like to take this opportunity to thank you again for having me on the ReGenMed101 podcast, and keep doing big things, and I look forward to whatever's coming up next. I will always be a listener here.
Dr. Jamal Khan is a chief resident graduate of Stony Brook University Hospital. He is currently doing a pain fellowship at the University of Minnesota. It is an ACGME accredited fellowship. Dr. Jamal Khan is also a fellow liaison to the Eastern Pain Association. He also works with me in the American Society of Interventional Pain Physicians Resident and Fellow section as a fellow liaison. We would like to thank him for his participation in our hip fracture episode on ReGenMed101 and also with this interview. We look forward to working with him more on future episodes on ReGenMed101. Thank you all for listening.
If you enjoyed listening to our podcast, please visit our Instagram, Twitter, and Facebook. For more detailed information, please visit our website at ReGenMed101.com.